Hi, I'm Marvin Plackett, and today is Friday, May 15th. Greetings to all residents, to all staff, and to all guests. Yesterday I reported that we had a COVID-19 confirmation with a resident at Episcopal Church Home. That resident lives in Gilbert House, which is the third floor of Episcopal Church Home. A day after that resident was tested, another 15 tests were taken and submitted the next day. Those results came back a few hours ago, and four of the 15 residents tested positive. 11 tested negative. That makes it a total of 5 residents in Gilbert House that tested positive. After consulting with our medical director, he recommended we transfer those 5 residents today to our dedicated COVID-19 unit on second floor to do our best job possible of isolating and containing the spread. Also, one more staff person at Episcopal Church Home tested positive yesterday. The transfer of those 5 residents, incidentally, is happening right now at this time. We now have a total of 13 confirmed confirmations, we have a total of 13 COVID confirmations. 7 are staff and 6 are residents. We are following all the guidelines for isolation, contact tracing, testing, infection control, use of PPE, etc. We follow all Minnesota Health Department regulations, CDC, CMS, and when someone slips up, you tell us. You know, there's eyes everywhere. Whether it's a staff person that slips up or a resident that slips up, you tell us, because there are eyes everywhere. This increased number of confirmations is bound to happen when there's increased testing. And some of you could be tempted to say to me or to any of us, why haven't you been testing sooner? And the only reason is because the tests were not available sooner until very recently, as in the last few days. Unless a person was showing symptoms, it was not possible to get tested. But now, as you know, last week there was a very concerted commitment by the governor, by the health department, to make nursing homes, long-term care settings, a priority, a very high priority, and that's why increased testing is now available. And more testing, incidentally, is going to occur. I mentioned this yesterday, that within the next 2 to 3 weeks, we are sure hopeful that we're going to be able to have all of the residents at Episcopal Church Home, all the residents at the Gardens tested, and all the staff at Episcopal Church Home and at the Gardens tested. That's our hope, that over the next 2 to 3 weeks, and certainly we will be keeping you updated on that. In all 6 cases of the positive tests that I've already mentioned that are residents, because we have 13 total confirmations, but 6 of those are residents. Of those 6 that tested positive for residents, 3 had only very mild symptoms, and 3 had no symptoms at all. So think about that. This shows the cunning nature of this invisible enemy. And that really confirms all the more why it is so vital that we follow the practices that we have in place of social distancing, a minimum of 6 feet apart, of wearing our masks, and that 6 feet apart, again, as I mentioned over and over, when it comes to our staff caring for our elders at our 2 nursing homes, most of whom are quite frail, that 6 feet of distancing is not possible when they are providing direct cares. And so that makes then all the more important the wearing of masks at all times by residents and by staff. And then the other practices, staying within your zones, frequent hand washing, no gathering in large groups. And then that ties right into my last point here, and that is, as you know, Governor Walz announced just 2 days ago that our society is going to start to open up. And when that happens, and of course it's measured, It's not going back to normal by any means, as he explained in detail. It's all on the website if you want to review any of that. And it's going to be a slow turning of the dial. When that happens, there of course are going to be temptations for people to gather, for people to want to do things like go shopping, etc., etc., etc. And for all of us, we need to just be ever so mindful of maintaining these key things of social distancing, of wearing masks at all times, and of staying home. On our campus, nothing is changing. At Episcopal Church Home, for our long-term care organization, at Episcopal Homes, all of our communities, nothing is changing at this time. And if anything changes, we will let you know promptly. So also before the end of the day today, I will be putting out my written weekly update, and it's going to be a summary of what has transpired since over these 7 days since last Friday. So that written update is going to go out to all residents, to all family members, and to all staff. And again, you can expect that every Friday from me. It's Friday. I won't be seeing you the next 2 days, but I do look forward to seeing you on Monday at 1:30. And now some words from Phil Rose.
Thank you, Marvin. So we know that the virus is here at Episcopal Homes, and that is a relatively recent change. But there is no change in our level of commitment and love and patience for all that is happening here, and our commitment to you, the residents and staff of Episcopal Homes. In spiritual life, we want you to know that if you just want to have a conversation, if you're a little anxious about things, just feel free to give us a call. You can call your housing manager and ask for each of our numbers, and we would be glad to have a conversation with you. And if you have prayer concerns and you'd like us to add you to our prayer list, please feel free to reach out to us. That's something I want to mention as well, that we are praying for you all of the time. I don't know if you are aware of that, but we are always keeping all the residents and staff in our prayers. And we pray especially now for protection for the staff, for the residents, and for all the families of people connected to Episcopal Homes. I found a poem that I thought was really relevant to what we're going through, and it's called One. And it really gets across the importance of how each one of us can have an impact. One tree can start a forest. One smile can begin a friendship. One hand can lift a soul. One word can frame the goal. One candle can wipe out darkness. One laugh can conquer gloom. One hope can raise your spirits. One touch can show you care. Not now. One life can make the difference to be that one today. I invite you all to consider how you can be the one. How can you make a difference in small ways to the people around you? Be well, and we will see you on Monday.